The use of imaging biomarkers in disease diagnosis. Title: The use of imaging biomarkers in disease diagnosis. Introduction. Advancements in medical imaging technology have revolutionized the field of disease diagnosis. Imaging biomarkers have emerged as important tools in the assessment and management of various diseases. These biomarkers provide valuable quantitative and qualitative information that aids in early detection, accurate diagnosis, and monitoring of disease progression. This article explores the use of imaging biomarkers across different medical imaging modalities and their significance in disease diagnosis. Imaging biomarkers, enhancing disease diagnosis. Imaging biomarkers are measurable characteristics obtained from medical images that help detect, predict, or monitor the progression of a disease. They can include various parameters such as size, shape, density, signal intensity, blood flow, metabolism, and diffusion. These biomarkers allow clinicians to objectively evaluate tissue characteristics and identify abnormal patterns associated with specific diseases. 1. Magnetic resonance imaging, MRI biomarkers. MRI is a non-invasive imaging modality that provides detailed anatomical and functional information through the use of biomarkers. 2. Computed tomography, CT, biomarkers. CT imaging utilizes X-rays to generate cross-sectional images of the body. For instance, CT-derived calcium scoring can be used to predict the risk of developing coronary artery disease. 3. Positron emission tomography, PET, biomarkers. PET imaging combines the use of a radioactive tracer with functional imaging to assess metabolic activity and tissue physiology. By measuring the accumulation of radiotracers, PET biomarkers can assist in the diagnosis and monitoring of various cancers, neurological disorders, and cardiovascular diseases. For example, FDG PET is commonly used to assess tumor metabolism and monitor treatment response in cancer patients. 4. Ultrasound biomarkers. Ultrasound is a widely available, cost-effective imaging modality that uses sound waves to create real-time images of the body. Additionally, Doppler ultrasound can assess blood flow characteristics and identify vascular abnormalities. Clinical applications of imaging biomarkers. Utilizing imaging biomarkers in disease diagnosis has several key benefits for both patients and healthcare providers. These biomarkers allow for early disease detection, more accurate diagnosis, personalized treatment planning, and monitoring treatment response. They also facilitate the development of novel therapeutic strategies and serve as reliable endpoints for clinical trials. 1. Early detection and diagnosis. Imaging biomarkers provide insights into disease processes at an early stage when interventions can be most effective. Through the identification of subtle changes in tissue characteristics, clinicians can intervene before symptoms manifest, improving patient outcomes and survival rates. 2. Treatment response monitoring. Imaging biomarkers play a crucial role in monitoring treatment response and assessing therapeutic efficacy. Changes in biomarker values over time allow for objective measurements of disease progression or regression, guiding treatment decisions and adjustments. 3. Personalized medicine. Imaging biomarkers enable precision medicine by providing unique information about an individual's disease characteristics. By tailoring treatment plans to the specific needs of each patient, healthcare providers can improve therapeutic outcomes and reduce unnecessary interventions. AI algorithms can rapidly process large volumes of medical images and extract valuable information, providing radiologists with valuable insights and potentially reducing interpretation variability. 1. Image segmentation. AI algorithms can accurately segment anatomical structures and lesions from medical images, allowing for precise measurements and quantitative analysis. This segmentation process enables the extraction of biomarkers related to size, shape, and texture, providing clinicians with valuable information for disease diagnosis and monitoring. 2. Classifying and characterizing abnormalities. AI algorithms can be trained to classify and characterize abnormal findings on medical images. These models can assist in personalized treatment planning, guiding clinicians in selecting the most appropriate interventions for individual patients. Challenges and future directions. While imaging biomarkers and AI algorithms show great promise in disease diagnosis, several challenges need to be addressed for their widespread implementation. 1. Standardization. There is a need for standardized protocols and guidelines for acquiring, quantifying, and analyzing imaging biomarkers. This standardization would ensure consistency across different medical imaging centers and facilitate multi-center studies and data sharing. 2. Validation. The performance and reliability of imaging biomarkers and AI algorithms need to be validated in large-scale clinical trials. This validation is crucial to determine their accuracy, reproducibility, and clinical utility, ensuring their acceptance and integration into routine clinical practice. 3. Ethical considerations. The use of imaging biomarkers and AI algorithms raises ethical considerations regarding patient privacy and data security. Safeguards must be in place to protect patient information and ensure responsible use of these technologies. Looking ahead, the integration of imaging biomarkers and AI algorithms holds immense potential for improving disease diagnosis and treatment. As technology continues to advance, it is expected that imaging biomarkers will become increasingly personalized, allowing for precise patient-specific interventions and treatment monitoring. The role of imaging biomarkers in precision medicine. Precision medicine aims to deliver targeted therapies based on individual patient characteristics. Imaging biomarkers play a crucial role in enabling precision medicine by providing unique insights into disease characteristics. 1. Phenotypic imaging biomarkers.